Hi, everyone. Thank you for joining. We'll get started with our stress management webinar in just a few seconds. All right, we'll get started on our webinar, Stress Management, Small Changes to Get Big Results. I'm Dr. Janice Joerges. I'm a naturopathic doctor and one of the doctors here at Thrive Holistic Medicine. So we do have a disclaimer that today this webinar is just for informational and educational purposes. If you would like specific advice or recommendations for you, you're welcome. If you're already one of my naturopathic patients, you can just send me a message via Charm. Or if you're interested in more information, you're welcome to reach out to set up an initial visit. So when we talk about stress, we often think of stress as this bad, heavy thing. And stress isn't always a bad thing. In fact, stress can be helpful because it can help us overcome challenges. It can help motivate us to reach our goals. And stress can even push us to excel outside of our comfort zone. So if we're always doing the same things in the same routine, we might not be feeling the stress that it takes for us to try something new and to really grow. So when stress is a bad thing, though, it can cause some physiologic changes within the body. It can cause blood pressure to elevate. And if you're experiencing stress for a long time, that elevation can remain high. Heart rate variability, which is the change in time between each heartbeat, that can change and it can increase. And we found with research that heart rate variability is related to long-term poor health outcomes. You can also notice anxiety and depression, other mental health changes as well. Some people notice digestive issues. If you've ever felt stress and then had your stomach ache, for example, or you're in a stressful situation and all of a sudden you've got to go to the bathroom. That's common too. Weight gain is another side effect from the harmful stress, and memory and concentration difficulties. In fact, some research has found that IQ points actually drop during stressful periods. So we need to talk about the different types of stress. So eustress is that positive stress that I was first talking about. Eustress is often short-term, and it allows us the time and space to recover after the stressful event. Distress is the negative stress, and that's often ongoing and it's exhausting, both mentally and physically. People feel overwhelmed and like they can't cope because they don't feel like they have the skills and resources available to address these problems and to fully resolve them. So when we're thinking about stress, the first step is to identify your stressors. I recommend taking 1 week, and either a lot of people will just keep track in their phone, either in a note section or in their calendar. When during the day are you feeling stressed? And the awareness is the very first step, because then you can figure out, is the stress you're feeling that positive eustress, or is it the distress? So on this slide, I have included a few examples of each. And that's really important because Once you identify what the positive stress is and what the negative distress is, then you can really start working to address them in the appropriate way. So some examples of eustress are starting a new job, right? Because you got a promotion or because it's an advancement for your career. But at the same time, an example of distress would be a lost job or lowered hours, less income. And so it could be the same situation, right? You're out of work, but out of work in a good way or out of work in a negative way. So take the time to really think about these stressors in your life. And throughout that week, I recommend including weekends too, because often we think of weekends as our time to de-stress and to relax. But for a lot of us, it's just that's when we're trying to fit in all the things that we didn't get to do during our work week. So what can we do about this stress? The first thing is we can change our perspective. And so we can say, okay, in the stressful situation, can we convert some of that distress into eustress? So can we see this as an opportunity where we can grow as an individual or where we can learn something new? Can we use tools to expand our resources? So if during your week of assessment, if you realize like, finances are very stressful to me, there are a lot of budgeting tools available now. And so you put in a little bit of work at the beginning, right? Either with getting recipes or doing some meal prep or finding these budgeting tools. And then you start putting them into your life. And with time, they're going to decrease that distress that you're feeling. Also, can you delegate? This is a great time to see what you're dealing with. What of that can be given to your loved ones, right? Family, friends, even your community. And if those aren't options, even looking at hired help. I talk to a lot of moms who are overwhelmed. They're overwhelmed with taking care of their families. And if they can outsource one thing, like having a house cleaner come and just do a deep clean once a month, so then they just have to keep it tidy, that can decrease stress. I talked with some of my clients are dealing with complex family situations. And so maybe taking care of mom and dad can be shared among siblings instead of always relying on one person. So we also can look at other ways that we can support for those periods of distress. So making sure that we're getting nutrient-dense foods, drinking purified water. And I say purified because this is very important. Unfortunately, our water isn't safe to drink out of the tap anymore. So making sure that you're drinking that purified water so you aren't overburdening yourself with heavy metals and other toxins. Exercise. Now, exercise is an important one because we want to make sure that you are doing exercise that is good and supportive for your body. We don't want it to be anything that's too complicated for your body to handle or that's too much, because then that can push you right back over into that distressed state. So most people do really well with a gentle stretching. If you're already doing exercise, making sure that you're incorporating some stretching into that. Taking walks, right? We don't all need to be powerlifting. Now, I have nothing against lifting and it's great for a lot of people, but it's okay to start where you are and just increase a little bit from there. Also, sleep hygiene. How many people now go to sleep looking at their phones, right? Making sure that you're taking a break from your screen and especially from social media. Taking a break from that at least 1 hour before bedtime, giving your body and your brain that time to calm down and to relax. And last on the slide, you'll see vitamin R, which vitamin R is recreation. And so much of our lives are errands and chores and work, and making sure that you carve out some time so that you can just have recreation in your life, have some joy. And I challenge you all, along with doing that week assessment of what brings you stress, right down to what brings you joy. We call this our joy list. And so then in periods of stress, you can return to that joy list and pull something off of there. Maybe it's taking a walk in nature. Maybe it's talking to a dear friend on the phone. Maybe it's floral arranging. It could be anything, right? But find what's individual for you that brings you joy. Also, on this slide, this is explaining how to do alternate nostril breathing. And I often recommend this when we are in that period of stress. So we feel that fight or flight kind of sympathetic response. Maybe you can feel your heartbeat. Maybe it's harder to take a deep breath. Maybe you just feel overwhelmed and you want to hide or you want to run away. So you would block one nostril. So you would block, in this case, your right nostril. And so you would inhale through the left, and then you would block the left nostril and exhale through the right. And then you would inhale through the right nostril and exhale through the left. And doing this mindful breathing technique of alternate nostril breathing allows your body to slow down, to become aware of the breath that's moving in and out of your body, to remind your autonomic nervous system that you are safe. There's no bear chasing you. So I do recommend, even in periods of stress, turn to this. But even when you aren't particularly feeling so stressed, give this a try, get used to it, get comfortable with it. Also, we can look at some supplemental support. So B vitamins overall are very important for the stress response within the body, especially B12. And the reason I've written out methylcobalamin is you want the methylated form of B12. Some individuals have a difficult time methylating in their body. And if that happens, you want to make sure that you're taking this methylated form so your body can use the B12. L-theanine is a supplement that's also been proven to decrease stress and to reduce anxiety. It can also help with sleep. Vitamin D, especially if you're in Wisconsin where we are not able to make vitamin D with this limited sunlight that we have right now. The sun's just too far away. So making sure that you're taking vitamin D is not just important for stress response and for your adrenal glands, but it's important for all systems in the body. And research has shown that it helps decrease the risk of cancer. Magnesium glycinate. If you've listened to my other webinars, you know I love magnesium. Love it. But each form of magnesium does something different within the body. Magnesium glycinate has been researched to be helpful for periods of anxiety. So stress, anxiety. Also, it's great for sleep. It helps the body to relax. It helps to relax the muscles. So if you've ever seen a stressed person, right? They're usually like this with their shoulders up. Sometimes their hands are clenched. Sometimes they'll get jaw pain because they're clenching their teeth. Sometimes they'll get neck pain. So letting your body just relax. The magnesium glycinate can help with that. I'm also a huge proponent of homeopathy. It's something that's available and accessible, and it works wonderfully for so many people. Caliphos in a 6x potency is called a cell salt. And Caliphos is useful for stress, nervous tension, especially if when you get stressed, you get headaches. It can be really useful for that. Also, the alpha stim, there are little ear clips, or you can, especially for children or younger individuals, you can clip it onto the web of the fingers. It sends a gentle alpha wave through the brain, which has been proven with continuous use to be as effective as anti-anxiety medications and to help with insomnia. So alpha stim is something to consider as well. We must not overlook the importance of psychological support. So in that slide where I was talking about what about delegating, for so many individuals, it's really hard to admit, I can't handle this right now. And for some of us, we don't feel like we have the community. And so we keep saying yes and yes and yes to things when really what we need to be working on is creating those boundaries and saying, I can do this, but this is all I can do. And also respecting other people's boundaries. So therapy or counseling can help with that. As a naturopathic doctor, I was trained in holistic counseling. So looking at some of the mental health issues that are happening and also relating those to physiologic issues. So maybe it is like your body just needs more magnesium and you need help with the boundaries. Or maybe you've been so focused on work and taking care of others that you need the permission to come back to that joy list. Also, journaling is a wonderful way to get out all of these thoughts. Sometimes for my patients who have what I call busy brain at bedtime, writing down everything in that hour from when the phone turns off and the lights dim and the soft music comes on, getting out everything that's burdening your brain in that time. That way, when you lay down to sleep, your brain feels complete and ready for rest. Also, I have recovery groups on here. So much stress that we feel isn't ours. Maybe it's from childhood, from growing up with a narcissistic family or growing up with alcoholics in your family. So turning to those recovery groups for additional support to help ease that stress. And I love this little picture, stress and wellness, right? They have the same ending. All we have to do is just shift a little bit. So one small change. I know there were a few options on here of things to look at. If you make one small change and you continue it every day, over this next year, you're going to have big, big results. And that's really what I want for you. I want you all to be living and thriving in your life. If you have additional questions, please feel free to share those now. Also, if you're curious about what a visit would look like, we do offer complimentary discovery calls where we can talk about what working with a naturopathic doctor looks like. We also have in-person appointments and virtual appointments as well, because especially I know with us being in Wisconsin, we have people all over who want this help and who would like some help, not just with their stress, but maybe with other areas of their lives as well. So I'm looking at the chat just to see if there are any messages here. Oh, here we go. Oh, Kathy, hi, yes, you're very welcome. All right, well, I will, oh, here we go. Okay, so I'll just, oh, Kathy mentioned the biomat. So we do have the biomat here. It uses amethyst crystals to help the body regulate. It's very helpful for pain, but it can also help with stress as well. It helps the body to re-regulate itself. So bringing that autonomic nervous system out of that stressful fight or flight and back into that calm, rest, digest, parasympathetic state. We do also have a sauna here, and the sauna is a great way to help your body de-stress, to relax, to get some of that toxic burden through the sweat released from your body. Plus, I mean, anytime you're doing anything for yourself, that self-care is so important. Make sure that you're prioritizing your health, okay? And we had talked about those, the changes that stress can cause. If you're experiencing those digestive changes, constipation, for example, or a lot of gas and bloating, you can use colonics to help with those, colon hydrotherapy, especially the way that we do it. We do a slow fill method called the Shea way, and this allows the body to really stimulate that parasympathetic nervous system, reset the digestive system, and bring you back into connection with your body. We also do testing like the Dutch test to look and see about if your body's adrenal system is overtaxed. You have high cortisol. Has that high cortisol led to low melatonin, and is that related to your insomnia as well? Also, with those digestive changes, when our bodies are under high periods of stress, we're at a higher risk for leaky gut or a relaxation in those tight junctions in the small intestine where the nutrients are absorbed. So sometimes food sensitivity tests can be helpful in giving your body a reset that way as well. There is another question about the MTHFR mutation. And yes, methylcobalamin, the methylated form of B12, is the one that is helpful with the MTHFR mutation. And since a lot of people don't know if they have that mutation or a difficulty methylating, taking that B12 is helpful. Well, thank you all so much for joining us today for this webinar. And I hope that you learned a little something, and I hope that 2024 is a year of less stress for you. Thank you so much.